Hello everyone. Today in the subject of medical microbiology, we are going to study about a disease called pneumonia. So the main objective of this lecture is to make you understand what is the scenario of pneumonia, and outcome will be you will be able to understand what are the prevention and cure of the disease caused by pneumonia. Right. So pneumonia is an inflammatory condition of the lungs, primarily affecting the small air sacs known as alveoli. So the main condition is that it causes the inflammation inside your lungs. Okay, the primarily the small air sacs that are present in your of your lungs, they are known as alveoli. Right. So symptoms typically include some combination of productive or dry cough, chest pain, fever, and difficulty in breathing. So, these are some common symptoms when you are going to have some difficulty in your lungs. Okay, well, any sort of inflammation, any sort of irritation. So, you are going to feel the typical dry cough, chest pain, fever, and difficulty in breathing. The severity of of the condition is variable, right? So the individual might show variable condition. It might differ from person to person. Pneumonia is usually caused by the infection with virus or bacteria. So sometimes it is caused by virus and sometimes it is caused by bacteria, or and less commonly by other microorganisms also. So here you can very easily see the different differences in pneumonia. Right, in this lecture, we are going to deal with the pneumonia caused by bacteria. So, diagnosis is often based on symptoms and physical examination. Chest x rays, blood test, and culture of the sputum may help confirm the diagnosis. So, uh, when the person is always having inflammation inside the lungs, and he or she is feeling chest pain and difficulty in breathing and dry cough, then doctors they do recommend a lot of testing that may include chest X-rays, blood test, culture of the sputum, may help confirm the diagnosis. The disease may be classified by where it is acquired, such as community or hospital acquired, that is also known as nosocomial infection, or healthcare associated pneumonia. So, what they're trying to say that whenever you are visiting any sort of hospital, right, or any health clinic, you have to be extremely cautious and careful because you might not only catch infection, but that infection probably be of a secondary nature. Secondary nature defines the condition as uh, before your arrival, some patient would have been sitting on that bench. He would have been coughing or sneezing, or with his contaminated hands, he would have touched the furniture, and you came after him and you sat on that very furniture, and you suddenly came in contact with harmful pathogens that which were affecting that person. Now you are in straight with into the contact of that very that very pathogen. So these are such type of grafts or disease is known as hospital acquired infection or nosocomial infection. So pneumonia is a very serious condition and it should be taken seriously and should be treated properly. So here you can see that in the image, uh, always within the lungs. Okay, so yeah, they are showing you the left lung. What is having this is the structure of normal alveoli. Bronchioles are tiny airways, and air sacs are these alveoli, and alveoli with air spaces, and here the proper mixing of oxygen with blood takes place. Okay, with the partial pressure, oxygen gets outside of the blood, and oxygen gets mixed with the blood, right? And hemoglobin carries oxygen to every cell of your body. Alveoli with pneumonia, inflammation in the alveolar wall. So fluid and pus-filled air sac contains bacteria and blood cells, like WBCs and all those things, and they are fighting with the bacteria, and this fills the air sac with fluid. So as a result of that, you can see that the alveoli are not performing their normal function. Okay, they are supposed to be filled with air, not to be filled with fluid. And most probably, and most importantly, they should having active circulation of blood. But because of this, the blood will also not be able to circulate inside them. So the individual will also feel the weakness because his body is not getting enough amount of oxygen that is normally required by the individual. So such conditions they do play a lot of role, and they do present a lot of difficult situations. So such conditions are they can be very lethal if uh, uh, the treatments are not taken seriously. And lobular pneumonia in lower lobe of left lung, Streptococcus pneumonia. So here you can see that alveolar sacs are filled with fluid. Okay, so mainly Streptococcus pneumonia it affects the uh, inner part of your respiratory system. Okay, so this condition is very severe and it is very uncomfortable for the individual who is suffering with uh, lobular pneumonia. Risk factor of pneumonia include cystic fibrosis, chronic obstructive pulmonary disease, sickle cell disease, asthma, diabetes, heart failure, a history of smoking, a poor ability to cough, such as following a stroke, and a weak immune system. So, if you are already suffering from these conditions, like cystic fibrosis, and the lungs are filled with mucus, and others like sickle cell anemia is there, right? When oxygen is not properly transported by the RBCs, diabetes, when insulin is not being produced properly or being produced properly but not being utilized by the cells, heart failure, and that is most probably by the coronary artery blockage, and heart is pumping blood to everyone, but blood is not being pumped back to heart because heart also needs some nutrition and oxygen. And if the individual is having history of smoking and all those things, etc., etc., that results in a weak immune system. Then that very particular person is much more uh, likely to be uh, likely to be catching the pneumonia infection. Okay, vaccines to prevent certain types of pneumonia, such as those caused by Streptococcus pneumonia bacteria linked to influenza or linked to COVID-19, are available. So vaccines are also available, and here you can see the Streptococcus pneumonia is also causing pneumonia, and COVID is also causing pneumonia. Conditions are known to everyone nowadays, and it is a global outbreak of a pandemic situation. And whatever the condition is, it is really a painful condition for the individual. Other methods of prevention include hand washing to prevent infection, not smoking, and social distancing. So, The summary of the story is that you always have to take care of the personal hygiene. Okay, you always have to be very much aware of your personal hygiene. You must always be really cautious. Okay, and you should never smoke, and you should maintain 6 feet distance from everyone. Okay, and social distancing is extremely important because when the individuals are coming into in your direct contact into your personal space, the droplets are very much responsible for spreading such kind of diseases or such type of pathogens. Okay, here in this image you can see the small airways and healthy small airway or alveoli and small airway with pneumonia, germs, white blood cells, and mucus is filled inside the airway or alveolar sac. Treatment depends on underlying cause. Pneumonia, believed to be due to bacteria, is treated with antibiotics. If the pneumonia is severe, the affected person is generally hospitalized. Oxygen therapy may be used if oxygen levels are low. Right? Yeah. Each year, pneumonia affects about 450 million people globally. That is around 7% of the total population, and results in about 4 million deaths. So, still, this disease is causing a lot of deaths all around the world. And pneumonia should be treated properly. And if the individual is having any difficulty in breathing, he should or she should immediately consult the doctor. And every time, if your oxygen levels are going low, you should always take oxygen therapy immediately. And as a result of that only, if you take precautionary measures, you would never have any sort of difficulty that is life threatening. But you have to always stay active, and you always have to stay cautious with the symptoms or what the disease is and what direction the disease is progressing. If the individuals are cautious and they understand the scenario, so this disease cannot affect them lethally. With the introduction of antibiotics and vaccines in the 20th century, survival has greatly improved. Right? Nevertheless, pneumonia remains a leading cause of death in developing countries. So, and also among the very old, the very young, and the chronically ill. So, this disease has a particular pattern. Earlier, when antibiotics were not there, then the situation was much more severe and much more difficult. And when the Robert Koch led to his experimentation procedures, and eventually this caused to the development of vaccine in the 20th century. The survival has greatly improved, and we have found a cure of many diseases. But still, we lack in the situation of viruses because we only are fully capable of treating the symptoms. Okay, we are not still we are working on the procedure of curing the disease. We can only cure the symptoms. We can only take care of the symptoms. We still cannot fully eradicate the viral disease with our medications. Nevertheless, pneumonia remains a leading cause of death in developing countries. Okay, and this very particular disease focuses on very old individuals or very young individuals who are just what you say toddlers or newborns and chronically ill. If the individual is very much uh, not at all having a strong immune system and is suffering from some very severe illness, then the story is very much different. Pneumonia often shortens the period of suffering among those already close to the death. and thus being called the old man's friend. So this disease particularly focuses on the old individuals. Okay, if the individual is suffering and he's close to his death. Okay, so pneumonia mostly attacks the individuals who is already close to death and most probably causes the end of their life. So that is why they are. It is also known as the old man's friend because it shortens the period of suffering those who are about to die. So main symptoms of infectious pneumonia are central headaches, loss of appetite, mood swings, okay, and systemic high fever, chills, and when it comes to skin, cleanliness, blueness, and when it comes to the vascular things, low blood pressure is very common. Heart rate, high heart rate, because heart is trying to pump oxygen to the lungs, and lungs are not responding properly. Gastric, nausea and vomiting, and joints you will always feel pain. Lungs, cough with sputum or phlegm, shortness of breath, pleuritic chest pain, and uh, mortal, and muscular fatigue and aches. Now coming on to the story of Streptococcus pneumonia. Streptococcus pneumonia or pneumococcus is a gram-positive spherical bacteria, alpha hemolytic under aerobic conditions or beta hemolytic under anaerobic conditions. Facultative uh, uh, anaerobic member of genus Streptococcus. So it requires uh, a facultative nature to be anaerobic in its nature, right? So most of the time it is gram positive in nature and it is facultative anaerobic member of the genus Streptococcus. They are usually found in pairs like Diplococca. So this Streptococcus pneumonia bacteria is a coccus in nature, right? It is somewhat in cocci shape and it develops in the formation of strings. Okay, as they have stated that they are usually found in pairs like diplococci and do not form spores and are non-motile. They are not very motile. They do not move from one place to another, right? And they are always linked with each other in chains, like the chain structure. So you can also say that the Streptococci chain. They are usually found in pairs, like Diplococci pairs of two, and do not form spores and are non-motile. As a significant human pathogenic bacterium, Streptococcus pneumonia was recognized as a major cause of pneumonia in late 19th century and is the subject of many humoral immunity studies. So it has led to the towards the study and immunology concerns in the late 19th century, when people started to recognize the Streptococcus pneumonia and what are its potential hazards and what type of disease it causes. So people started to work on this, and people started to uh, increase their knowledge and started researching on this very particular type of pathogen. So here in the image you can see the structure of Streptococcus pneumonia. It is Streptococca, coccus in nature, right? Here you can see the capsule. It is gram-positive in nature, cell membrane, cell wall, DNA, and cytoplasm. And nearby that image, you can also see the original image of microscope and what what is the real picture of that Streptococcus pneumonia. So you must always keep in mind that this bacteria is gram-positive in nature and facultative anaerobic in nature, right? So it does not require oxygen for its functionality, and its genus is Streptococcus, normally found in pairs of two cocci. Okay, and it does not form spore. It is not a very motile bacteria, right? And it causes a significant number of deaths among the individual. Until the evident of 19th century, when science developed, biology developed, and new techniques were evolved for the identification of these bacterial pathogens. So here you can see the Streptococcus pneumonia. Strepto means chain, coccus means round shape, pneumonia causes pneumonia. So Streptococcus pneumonia means chains that are round in shape causes pneumonia. Okay. So here you can see the structure also, Streptococcus pneumonia also, that how this particular type of bacteria looks like, and it is a round bacteria that grows in chains and most common cause of community acquired pneumonia. So this particular type of disease can readily be transferred from one individual to another if you are coming into close contact with the people. So in this whole scenario, you have to be really careful and you have to be really very much extremely cautious and maintain the concept of social distancing and always washing your hands, wearing mask, maintaining personal hygiene. This type of disease is mostly community acquired pneumonia. Okay, when you are coming into contact of a lot of crowd and a lot of people, so then you are more likely to catch such kind of disease if your immune system is not functioning up to the mark. Then this problem can arise readily in your lungs. So, Streptococcus pneumonia resides asymptomatically in healthy carriers, typically colonizing the respiratory tract, sinuses, and nasal cavity. So, if the individual is really very healthy, okay, if the individual is not at all having any issues, any problem, any health concerns, then that if that individual catches pneumonia, then he or she will carry them asymptomatically. They will never show any symptoms about this streptococcus pneumonia, and they will be known as the healthy carriers. And typically colonizing the respiratory tract, and sinuses and nasal cavity. So it will grow all around your respiratory system, right? So this will readily increase and enhance the respiratory system, and it will keep on growing, and it will also reach your respiratory tract, but also proceeding ahead from your sinus and your nasal cavity. So this is a very important thing to be noted, that streptococcus pneumonia can readily be uh, very different in nature, and it can also be asymptomatic in nature, right? However, in susceptible individuals who are having weak immune system, with weaker immune system, such as the elderly and young children, okay. So what are its main targets? The individuals who are really very susceptible in nature, individuals who have weak immune system, and elderly and young children. The bacterium may become pathogenic and spread to other locations to cause disease. Okay, so this is how This bacterium is very pathogenic in nature and can readily spread to other locations to cause this particular disease. So the individuals who have already conditions that are immunocompromised in nature, they should really be cautious about such kind of diseases, and they should always take precautionary measures to protect themselves. It spreads by direct person-to-person contact via respiratory droplets and by auto-inoculation in persons carrying the disease bacteria in their upper respiratory tract. It can be a cause of neonatal infections also. So if the person-to-person contact is there and people are sharing their personal spaces and not maintaining social distancing of 2 meters or 6 feet, then the droplets that serve as a auto inoculation system. Okay, in persons carrying the bacteria in their upper respiratory tracts. So most of the time, the asymptomatic individuals who do not show any signs of pneumonia, although they are carrying out this disease in their system, and they do serve as a source of an active carrier, they can also cause neonatal infections, especially the infections in newborn children. Mechanism: pneumonia fills the lungs alveoli with fluid, hindering oxygenation. So its main aim is to hinder the oxygenation process of your lungs. The alveolus on the left is normal, whereas on the right is full of fluid from pneumonia. So it always affects your right lung. Okay, this is the point to be noted. Pneumonia frequently starts as an upper respiratory tract infection that moves into the lower respiratory tract. It is a type of pneumonitis, lung inflammation. Okay. So, what is the pattern of pneumonia when it starts? It starts with the upper respiratory tract and it moves further into the lower respiratory tract. And this type of pneumonia is known as pneumonitis. Okay. Or lung inflammation or the lung inflammatory condition. The normal flora of upper airway gives protection by competing with pathogens for nutrients. Okay, you already know that our human body is already housing a lot of microbiota. So they are already there and they do give uh, this pathogen a tough competition if it is trying to invade inside the body. In lower airways, reflexes of the glottis, actions of complement proteins and immunoglobulins are important for protection. So are these defense mechanisms are also trying to uh, prevent us from getting this lethal infection. But this bacteria is constantly trying to invade it. So this struggle normally leads into the procedure that causes a lot of difficulty and creates a lot of pus and mucus and all the dead cells. Microaspiration of contaminant secretion can infect the lower airways and cause pneumonia also. Okay. The progress of pneumonia is determined by the virulence of the organism. The progress of pneumonia is determined by the virulence of the organism. Like how virulent is the pathogen? Okay, your progress of pneumonia will readily be dependent on it. The amount of organism required to start an infection and the body's immune response against the infection. So it does not affect like that. You got one Streptococcus pneumonia into your system and you got pneumonia. No. So you must understand that particular amount of Pathogenic bacteria are required to cause this particular type of infection. And the body's immune response is also very important to fight against the infection. Okay, first this bacteria will try to invade into your system, then it will readily increase the number of its population, then it will try to and uh, infect the particular site in your body. So your body's immune response to fight this very particular infection is also very essential and utmost important. So if you are having the immune system that is up to the mark, then there is no issue. And if the things are very different and you cannot find any such scenario, then the disease will be lethal for you. And particularly these type of diseases, if they are not treated properly, they can prove to be extremely lethal. So you must always take care of such things when you are having uh, streptococcus pneumonia. Streptococcus pneumonia is the main cause of community-acquired pneumonia and meningitis in children and the elderly, and the sepsis of in those infected with HIV. The organism also causes many types of pneumococcal infections other than pneumonia. These invasive pneumococcal diseases include bronchitis, rhinitis, acute sinusitis, otis media, conjunctivitis, meningitis, sepsis, osteomyelitis, septic arthritis, endocarditis, uh, peritonitis, pericarditis, and cellulitis, and brain abscess. So there are many different kinds of infection that they can also lead towards infection if they are not treated properly. So coming on to the condition of HIV. HIV condition is very important to know because HIV it readily infects a human and hampers the function of its immune system. And immune system does not respond properly, and because it readily affects the T helper cells of your immune system and evades them. And in this process, it is making the immune system weaker and weaker. So if you are going to catch common cold, you are also going to die. But you will not die because of HIV. Because the main function of HIV is to weaken your immune system so that you can die with a common infection. Streptococcus pneumonia can be differentiated from viridans streptococci, some of which are also alpha-hemolytic using optochin test, as Streptococcus pneumonia is optochin sensitive. Streptococcus pneumonia can also be distinguished based on its sensitivity to lysis by bile. So it is called a bile solubility test. So this property is utilized in the testing of pneumonia. The encapsulated gram-positive coated bacteria have distinctive morphology on gram-stained, lancet-shaped diplococca. Okay, they have polysaccharide capsules that act as virulent factors for the organism. More than 90 different serotypes are known, and these types differ in virulence, prevalence, and extent of drug resistance. Bacterial pneumonia and is an infection of lungs caused by certain bacteria. The most common is Streptococcus, but other bacteria can also cause it too. If you are young and basically healthy, these bacteria can live in your throat without causing any trouble. But if your body's defense A defense's immune system becomes weak for some reason, the bacteria can go down into your lungs. When this happens, the air sac of your lung get infected and inflamed. They fill up with fluid, and that causes pneumonia. So, pneumonia symptoms are shown in this image. What are those symptoms? Fever, cough, chills, sweating, loss of appetite, nausea and vomiting, especially in small children, sharp rise in temperature, chest pain when coughing, severe weakness, uh, bluish skin, body aches, labored breathing, and difficulty in breathing. So, your alveolar sacs are filled with fluid normally. Those earlier they were functioning without any issues, but with the onset of pneumonia, they are filled with fluid that creates a lot of difficulty in breathing. You have a high risk of getting bacterial pneumonia if you are 65 or older, have other conditions like asthma, diabetes, or heart disease, or, or you are recovering from surgery, if you don't eat right and get enough vitamins and minerals, uh, have another condition that weakens your body's defenses, smoke, drink too much alcohol, and you already have viral pneumonia. So, people who have a weakened immune system also have an increased risk of bacterial pneumonia. This includes uh, those who recently had an organ transplant, people who are HIV positive, and who have leukemia, lymphoma, and severe kidney disease also stand a greater chance of developing the infection. Right? So, oxygen. Here you can see the normal function of the alveolar sac. You inhale oxygen, oxygen reaches the alveolar sacs, and bloodstream is constantly flowing, and carbon dioxide is replaced with oxygen. But what happens in pneumonia? Oxygen is unable to reach the bloodstream. Why? Because the alveolar sacs are filled with uh, fluid. The air sacs where the transport of oxygen was supposed to take place. So this condition is known as pneumonia. Transmission, it can readily be it is a uh, what do you say, a disease that is transferred with a lot of social contact, spread through contact with people who are already ill, who carry the bacteria in their throat. You can get pneumococcal pneumonia from respiratory droplets, okay, and that are transmitted by the infected individual. It is common for people, especially children, to carry the bacteria in their throats without being sick. So, how the diagnosis is performed or diagnosis is done? So, your healthcare provider will diagnose the symptoms like physical exams, lab tests, chest X-rays. Other bacteria and germs can also cause pneumonia. Therefore, if you have any of the symptoms of pneumonia, you should get diagnosed early and start taking medicine if appropriate. Your health care provider can usually diagnose pneumococcal pneumonia by finding Streptococcus pneumonia bacteria in your blood, saliva, or lung fluid. So they can readily have this thing examined and tested for the confirmation of your disease. Symptoms you already know: uh, high fever, coughing, greenish yellow, and bloody mucus, chills that can make you shake, feeling like you can't catch your breath, breathing problems, especially when you move around a lot, feeling very tired, low appetite, sharp or stabby chest pain, especially when you cough and take deep breaths, sweating a lot, fast breathing and heartbeat, lips and fingers turning blue, confusion, especially if you are older. So, what are the preventive measures? How this disease can be prevented? PCV13 or Prevena 13 is for people who are 65 or older. Okay, these are the shots that are available for the people. Kids under age of 5 years, people who have a high risk of bacterial pneumonia. PPSV 23 pneumovax is for people who are 65 or older, children older than 2 who have a high risk of bacterial pneumonia, people between 19 and 64 who smoke or have asthma. So you should always talk to your doctor about your symptoms, and you should always be careful about the scenarios. Wash your hands regularly, especially after you go to the bathroom and before you eat. Always take balanced diet, eat right with plenty of fruits and vegetables, and exercise. Get enough sleep, quit smoking, stay away from sick people if possible. Antibiotic treatment for serious pneumococcal infection typically includes broad spectrum antibiotics until the results of antibiotic sensitivity testing are available. Antibiotic sensitivity testing shows which antibiotic will be most successful at treating a bacterial infection. Broad spectrum antibiotics work against a wide range of bacteria. Once the sensitivity of the bacteria is known, clinicians may choose a more targeted, narrow spectrum antibiotic. So they have to specify that which medicine is working best for you. Number of antibiotic resistant pneumococcal infection has decreased due to the success of the pneumococcal uh, conjugate vaccine. Okay, that has proven to be much more effective than normal medications. So here are some facts about pneumonia. There is no one cause of pneumonia. Okay, viruses are the most common cause of pneumonia, but medical experts have found that 30% uh, 30 causes of pneumonia, 30 different causes of pneumonia. Bacteria can cause it, fungi can cause it, so can mycoplasma, germs also can cause it. They are neither a virus nor bacteria. They are the smallest germs that can cause disease in humans. You can also get pneumonia from breathing food, dust, liquids, or gases into your lungs. Germs that cause pneumonia often live in your body. Many viruses and bacteria known to cause pneumonia may already live in your nose or throat. Your immune system usually keeps them out of your lungs. It's the body's defense system. But your immune system might be weak because it's already fighting off another disease. Then pneumonia can develop. Okay, because the immune system is somewhat engaged in some other thing, and then uh, another pathogen spots the weakness, and it will invade. Also, the immune system weakens as you get older. That's why your risk of pneumonia is higher if you are older than 65 years of age. Pneumonia can be deadly in young children. Pneumonia causes more deaths than any other kind of infection in children younger than 5. Most children who die of pneumonia live in parts of the world where nutrition is poor. If the diet is not proper for the individual, then the things are very difficult. The disease inside their homes may be polluted from heating with open fires. They also may live in very crowded homes. Parents who smoke in the house also put their children at risk of pneumonia. Breastfeeding helps prevent pneumonia. Breastfeeding for the first 6 months of baby's life can help keep the child from getting pneumonia. If the baby does not get pneumonia, breastfeeding may keep the infection from being long and serious. Research shows the breast milk makes a baby's immune system stronger. Breast milk also has a substance that keeps pneumonia germs from growing in baby's nose, throats, and lungs. So, coming on to the MCQs, the most causative agent in ventilated patients with late onset of pneumonia is MRSA, Asorius. The correct answer is Echinocobacter. HA is the second most common nosocomial infection after urinary tract infection or UTI. A 31-year-old male is admitted to the hospital 6 days ago, complaining from chest pain and coughing. He has chronic lung disease and he is on corticosteroids. Which of the following is a causative agent in the commonly seen in his case? The correct answer is MRSA. All of the following is the features of cap expect except is the correct answer is most cases caused by Streptococcus pneumoniae. Early onset of nosocomial pneumonia is MSSA. If MRSA is suspected in patients with Streptococcus aureus infection, what is the most appropriate antibiotic in their case? The vancomycin. One of the advantages of combining vancomycin with linezolid is less uh, nephrotoxicity. The common pathogenicity of pneumonia is microaspiration of upper airway secretions through uh, inapparent aspiration. The traditional approach of anti-pseudomonal drugs combination is anti-pseudomonal beta-lactam with aminoglycoside. A major factor that increases the resistance of gram-negative bacilli is A. Prior to the use of broad-spectrum antibiotics, B. Immunocompromised person. The correct answer is both A and B. So these are the references from where we have gathered the material. And thank you very much for listening to my lecture.